Here are 5 tips for successful recovery from breast augmentation. First, I would recommend having things set up at home before surgery. So after surgery, some surgeons will ask you to limit how much you're using your arms. And some will say not even to lift your arms above about 90 degrees. So think about things that you're going to want to do after surgery that might require you to potentially do that. So things that are up on shelves or things that are higher in your house, I would recommend putting at a lower position if possible. Make sure your bed is comfortable, make sure things are accessible, make sure you're not having to do anything that requires any lifting more than about 10 pounds, because we want you to restrict how much you're lifting for about the first 6 weeks after surgery. The second thing I would recommend doing is filling your prescriptions before surgery. Immediately after surgery, obviously you will just have undergone anesthesia, so you're not going to be able to travel, and we want you to have those medications available so you can start them immediately after surgery. That's both from a pain perspective as well as any antibiotics and any anti-inflammatory drugs to reduce the risk of you having any complications from the surgery. The third thing that I recommend doing is preparing meals for at least the first week after surgery. Again, after surgery, you're not going to feel as good as you do prior to surgery. And if you have things set up for at least that first week, that kind of gets you a running start for the first week after surgery. It doesn't have to be anything elaborate. I usually recommend that my patients have higher protein intake after surgery than they typically consume, just because you're trying to heal incisions and heal wounds from the surgery. So some people make steak and potatoes, some people will use the protein shakes. I think both of those are good options. But again, I would recommend having that set up prior to actually undergoing the surgery, so you're not having to run out to the grocery store and prepare meals right after surgery. Number 4, I'd recommend having someone at home to help you for about the first 24 hours. Whether that's a spouse, your own children, friends or family, someone who can help you in that first 24-hour period. You will have just undergone surgery with anesthesia, so you're gonna be a little groggy and kind of reacclimating to life right after surgery. If they're able to stay with you longer, that's great. You might require, setting things up. You get a babysitter to watch the kids so your spouse can help you, have, other siblings help you out, whatever the case may be. Obviously, everyone's social situation is a little bit different, but as long as you can have someone help you for at least that first 24 hours with this surgery, whether it's helping you prepare the meals, get things sorted around the house, just for you to get to a point that you're comfortable, I think that goes a long way. And number 5, I'd recommend having a comfortable outfit for you to wear after surgery. Again, with breast augmentation, there's manipulation of the breast tissue and or pectoralis muscle, so things are gonna be somewhat tender. After surgery, you're gonna have a surgical bra on, so I usually recommend that patients have some type of garment that's loose fitting that can go on top of that garment, because that's what's gonna be giving you the support. But obviously, you want to be comfortable at home, so whether you have some sweatpants and a loose t-shirt, just hang out after surgery, I would do that for at least the first few days after surgery, just to, again, help your recovery process. I'm Dr. Carlson. If you have any questions about breast augmentation surgery or interested in consultation for breast augmentation surgery, don't hesitate to reach out to us. You can find the link to our website below. If you like this video or have any questions, please comment below as well.